Good afternoon and welcome. My name is Ann Wilkie. I'm the Senior Regulatory Strategy and Policy Advisor for Dicentra, Inc., and I will be your presenter for today's Regulatory Update webinar offered by Dicentra. Dicentra is the leading international scientific and regulatory consulting firm with specialized expertise in the areas of natural health products, dietary supplements, over-the-counter drugs, foods, and cosmetics. As part of Dicentra's ongoing commitment to serve the natural health product industry as a source for education and trusted scientific and regulatory advice and information, we are pleased to be offering quarterly regulatory update webinars free of charge to all interested parties. In order to ensure that we are meeting your needs, we are asking you to complete a brief survey at the end of today's webinar. You will see the link to the survey in the chat room, and we encourage you to complete this before the webinar is over. For more information about Dicentra, please phone or email us or visit us at our website. The objectives of today's webinar are to provide you with up-to-date information pertaining to the implementation and interpretation of the natural health products regulations in Canada in order to help ensure that you're current with the requirements and aware of changing policies and procedures that may affect your ability to comply with the regulations. We also wish to provide you with other scientific and regulatory information that has relevance to the natural health products industry, such as changes in policies and regulations within the food sector. For the next 30 minutes or so, we will be looking at the following topics: regulatory initiatives and associated policies that are of relevance to the natural health products industry, personnel changes within Health Canada, again, that are relevant to the natural health products sector. We'll look at some of the activities of the Natural Health Products Directorate Program Advisory Committee, also known as PAC. We'll review the status of applications quarterly report for the government's fourth quarter. We'll look at new guidance and tools for the industry that have been issued by the Natural Health Products Directorate. We'll look at the status of different product categories and any information and warnings specific to those categories. We'll also look at new initiatives and process improvements coming out of the Natural Health Products Directorate. And we'll also look at food updates and other miscellaneous updates. So as you can see, we have a full 30-plus minutes ahead of us. So getting started, we'll look at regulatory initiatives and associated policies. During our first webinar of 2010, the position taken by the National Association of Pharmacy Regulatory Authorities was the hot topic. In this webinar, the proposed regulations, the proposed natural health products unprocessed product license application regulations will be the topic of discussion. NHP UPLAR is the acronym for the NHP, the Natural Health Products Unprocessed Product License Application Regulations. So why do we need another regulation at this point in time? Well, there's various things that have been happening. The natural health products regulations have been in force for 6.5 years now, and we're still not at a stage where we have full compliance within the industry. When the regulations first came into effect, there were some 40,000 products on the market. Of those 40,000 products, there are still 10,000 to 12,000 products that are not yet licensed, but that have an application in queue with the Natural Health Products Directorate. As well, the Natural Health Products Directorate is still dealing with applications in the backlog. Those are applications that were received and in queue before April 1st, 2008. So as they try to wade through the applications, they are continually getting more applications in. Further, there are no performance standards in place. When you put your application into the NHPD, there is no telling when you might get a response or you might get your license. The only performance standard right now is the 60-day disposition clause for compendial applications. Again, there's no predictability in getting to market, but that's changing. The natural health product regulations need to be enforced as written, and compliance and enforcement policies are changing as we speak. The current situation where you can go to market with just a submission number was undermined by the recent position of the National Association of Pharmacy Regulatory Authorities that put out a position statement saying that pharmacies should not sell any product unless it has a drug identification number, a natural health product number, or a DIN-HM for homeopathic medicine. This position was issued in January of this year and would have restricted access to safe products by consumers. It would have eliminated a market channel for suppliers, and it led to increased confusion in the marketplace. So it was recognized by the government as well as other stakeholders that something had to be done to support market stability, to ensure that consumers had access to safe quality products, and to give industry a measure of predictability in going to market. So the NHP, Unprocessed Product License Application Regulations, what exactly is this? Well, it's a temporary regulatory proposal. It will be a standalone regulation under the Food and Drugs Act. It's also temporary. Once it comes into force, if and when it does, it will be repealed 30 months later. It's only a temporary measure to give stability to the marketplace, to ensure consumer access to safe products, and to continue distribution of natural health products in the various distribution channels. Again, this is a voluntary exemption from the prohibition against sale without a license. Within the natural health products regulations, you are required to have a license before you can go to market with your product. This regulation, if it comes to pass, will allow certain products that meet specific criteria to be exempted from that requirement. And if they are issued an exemption number, they will be deemed to hold a product license. Again, this is a voluntary process. You do not have to opt into it. This regulation will provide for the legal sale of those products that are still unlicensed or have not had a licensing decision and that are on the market. There are various criteria that need to be met. You must have submitted a complete product license application, and after 180 days of that application sitting with Health Canada, you are still awaiting a licensing decision. Further, these products must not pose a risk to the health and safety of the consumer. So if your product falls into one of the following categories, you will not be able to take advantage of this regulation if it is indeed passed. And I keep saying that because it's still in the discussion stage. They're still looking at it. It's not a finalized regulation. So if you have a product that is a sterile product for ophthalmic use, if your product contains prohibited substances under the Food and Drugs Act, if your product meets Schedule A claims for diseases that require practitioner intervention, if your product is for use in children under 12 years of age or for use in pregnant or breastfeeding women, or if your product contains an ingredient that has been subject to a recall or stopped sale, you will not be able to take advantage of this regulation. The proposed regulation was published in Canada Gazette Part 1 on May 8th of this year with a 30-day comment period. And that 30-day comment period ended on June 6th, and written comments were submitted from a variety of stakeholders, including dicentra. It was a very short comment period, which tends to indicate that they're fairly sure that this regulation will go through, that it will be published. Typically, it's a 75 to 90-day comment period. So right now, the comments are being reviewed by the Natural Health Products Directorate and their legal advisors. And depending on the feedback that was received, if the comments that were received are fairly supportive of the regulation and can be addressed without any major changes to the proposal, then at the earliest we could expect to see publication of this regulation in Canada Gazette Part 2 on August 1st of this year. So again, if the stakeholders and the comments received are generally supportive of this regulatory proposal, then August 1st would be the absolute earliest that it would be published in Canada Gazette Part 2 and become effective. On the other hand, if significant objection is received to this regulatory proposal and major changes need to be made to the regulation as written, then it will have to go back to Canada Gazette Part 1, be subject to another comment period and analysis of comments. So again, that would put a delay of probably as a minimum of about 6 months.